Name is Jill, and I am 43 years old, and currently I am 25 weeks pregnant. And I definitely attribute Dr. Mandy to me getting pregnant naturally. So I did not use IVF through the methods that Dr. Mandy suggested to me. It really improved my health. And so here I am, 25 weeks pregnant with a healthy baby and looking to give birth in February. Things I've tried in the past for fertility have been an array of things. There have been so many different things, including IVF. So I do have an IVF baby. That was my second pregnancy. But between the first pregnancy to the second, I had a lot of miscarriages. And then after the IVF baby, I wanted to get pregnant a third time. So I had to try IVF again, and unfortunately, those failed. So I have run the gamut from everything from progesterone to IVF medications to prednisone to baby aspirin to all types of diet modifications to keto diet to an all beef diet to taking an array of supplements that I probably shouldn't have been taking because they weren't necessarily applicable to my genetics and the issues that I was facing. So I have been in and out of fertility clinics for about 7 years. It wasn't until I met with Dr. Mandy over my interstitial cystitis and also wanting to become pregnant with my third baby that I really was on the right track and that I was taking the right supplements and eating the right foods and participating in the right activities like the right exercise and etc., that I was able to get pregnant. So she really tailored a custom design protocol for me and my body. When I worked with Dr. Mandy, the test that I found to be the most eye-opening was definitely the HTMA test. It blew my mind because there were so many vitamin and mineral deficiencies that I had that I wasn't even aware of. I was also really fascinated when I did the mold testing because it came back that I had a very high level of a specific type of mold, and it was actually attributable to coffee. So I was drinking coffee beans that had a lot of mold in them. And then I switched to a decaf, organic, Swiss water processed coffee, and I didn't have the same levels of mold. The other major test that I did, and I cannot recall the name right now, was when she tested me for hidden infections. And I really think that that was a game changer for me because it turned out that I did have heavy amounts of E. coli, and it wasn't being picked up by any sort of doctor that I would go see. So I'd have all of this pain, and they were like, well, when you would urinate on the strip, it doesn't come back that you have any sort of infection. Meanwhile, I'm having all of this pain. So Dr. Mandy, after doing the elimination diet, all the supplements, she said, are you still having pain? And I did have a bit, and she's like, I think you have a hidden infection. So we proceeded with that test, and right away it showed that I did. And then I took the right antibiotics for that. And guess what? It was totally gone. And I felt wonderful. It was the first time that I had felt really good in like a year. And I'm positive that it had a significant effect on my fertility because when I had gone for IVF in July 2023, that transfer failed. And I couldn't understand why because I had had success before and I was having all of this pain, this urinary pain, and I was like, it has to be some kind of infection that I have. And yet the fertility clinic tested me and it showed that I didn't have any sort of infection. So it was very, very confusing. So when Dr. Mandy then put me on vaginal probiotics, she also had me take boric acid, and then she, had tested for infection. Everything cleared up, and within, I think it was 2 months from that date, I got pregnant naturally. Things that Dr. Mandy suggested to me to help me clear my IC, or at least put it into remission, and to get pregnant naturally, we did a host of things. The first thing that we did, elimination diet. She took me off oxalates because she found in my urinary testing that I had high oxalate levels and I was producing them endogenously. So I was eating them and I was also producing them internally. So that was a big factor. The other one was that she got me to eat a lot of fatty fish. And I was not somebody who ate a lot of fatty fish. I didn't like it at all. And so I kind of forced myself to do this. And I honestly think it was one of the big contributing factors as to why I got pregnant because I incorporated this into my diet, which I had never eaten before. The other things were ozone therapy. So I started doing IV ozone therapy. I also started really taking exercise seriously. And I took it, I was walking about a half an hour a day. And then I was also doing strength training. And I felt that that really helped me. I also was getting a lot of sunshine as she had recommended. And then, of course, we did an array of testing. So we worked on my thyroid. We also did the infection testing to see if I had any hidden infections, which was a massive improvement to what was going on with me because I 100% did have a hidden infection that no other doctor could find. And that made a huge difference. Also, the supplement regime. I will say this with the supplements, Dr. Mandy was very specific because she knew I wanted to get pregnant. So it wasn't just about putting my IC into remission. When she put me on hormonal supplements, this was a game changer. Um, the best way to describe it, this is a TMI sort of thing, but my period was like I was 21 years old again. Like it was just, it came back and it was, I didn't ever not have a period, but it was just like a youthful sort of period again. And I knew that I was on track because I had an acupuncturist who had told me that like I had had problems in that department. And once I started taking these hormonal imbalancing supplements, things really changed for me. And I could see the change within about 2 to 3 weeks. I also started fasting, and I'm pretty sure that the combination of clearing up the infection, the diet changes, et cetera, coupled with the fasting was totally what got me pregnant because I was fasting 1 day a week, 24 hours a day, doing that water fast. And then Dr. Mandy suggested that I start doing 2 to 3 days. And I did. I did 3 fasts about a month prior to me getting pregnant. Like I did a lot. I did like a 1.5 day. I did a 2 day. Did I make it to the 3 day? I don't think so. That one was really hard. But I was happy to do the fasting because she said, you know what? It's gonna change you on a cellular level. So I was happy to try anything. And all of this stuff was making me feel really good. It wasn't just about necessarily getting pregnant. It was also putting my IC into remission, and it was making me feel for the first time I didn't have the kind of pain that I was so used to living with. Out there and you're struggling to get pregnant, I really sympathize with you. I have been there. It is really heartbreaking and it's so traumatic, and it's also very lonely. But I'm hopefully going to give you some inspiration because, like I mentioned, I'm 43 years old and I'm pregnant naturally. One of the things that I knew that I had to do was I had to deal with my IC first. I had to go find a professional who could help me put my IC into remission because I was having pain every single day. And I knew that I couldn't get pregnant because of all of the issues I was dealing with my bladder. So I had an instinct. I felt that if I could at least dim the pain, maybe not alleviate it completely, that all the protocols I would be using would help me in my pursuit of pregnancy. And I guessed right. The thing is, I found Dr. Mandy online. I found her on YouTube because I had learned about oxalates. And I was like, I'm going to go to somebody who knows about oxalates because very few people do. And the other thing I liked about Dr. Mandy was that she is somebody who's dealt with IC. And I felt like that was so important to me that somebody could understand my experience and they could understand exactly what I was talking about. And I made it very clear to her that I wanted to get pregnant. And so that was always part of the protocol. So I definitely feel that it is important to find someone like a Dr. Mandy, of course, that will tailor a program specifically for you. Because the issues that I had with my infertility certainly are not the same things that can affect somebody else. But the thing is, she runs a host of blood tests and urinary tests and hair testing. and it's all specifically geared to you and your body. And I think that that is so important in the fertility world, because you read all these articles and they tell you take this supplement, take that supplement. Well, maybe you don't need those things, or maybe those supplements are causing damage for you and they're actually inhibiting your ability to get pregnant. Because that one time I was taking so many supplements, they were probably causing a negative reaction within me. So I was so happy when I got to deal with Dr. Mandy, because she was giving me tests that were geared specifically for me, and the results were for me, and the supplements that she gave me were totally in line with what I was dealing with, which made me really happy. Because one of the things she said is, you're not getting a specific type of nutrient that only fatty fish can give you. So when I started incorporating that in my diet, believe it or not, I started to feel better. I started to have better skin. My hair grew longer. I was losing weight. All these things that I didn't even think were necessarily the reason that I signed up with her, started to happen to me. And I figured in my mind, you know what? I'm going to be able to get pregnant because of the fact that I'm going through all of these amazing health changes. So I think that that is so important, to be able to find a Dr. Mandy that is able to tailor a program specifically for you. And I also love Dr. Mandy because she is very inspirational. She has put her IC into remission, which was like a goal for me. And I felt like she can do it, I can also do it. So that really put me on the right track. And, she would always check in with me and we would talk. And I was always telling her, listen, I want to get pregnant. The IC is important, but I want to get pregnant. And so she would tell me, these are some things you should do, like use a PEMF mat, do the fasting, try the ozone therapy. All of these things will help you in your oxidative stress. And she was totally right, 100%. I really, honestly, I want to thank Dr. Mandy so much, because I really believe in my heart that, like, if I didn't have Dr. Mandy, I would not have gotten pregnant. Like, I really believe that. I think she really helped me, and she also helped me not feel the level of stress that I was feeling. Like, I don't know what to do. I need so much help. I don't have any guidance. She kind of put all those fears to bed, and she really eased all of that stress. So for her, like, all of that, I'm really grateful, and like, thank God that I found her.